Hello, it's Dr. Petke. We are open here at the clinic. I am going to take this lovely mask off so I can actually talk and do this video. But I want to let you know that we are still open. Here we are seeing patients that are only acute or urgent pain patients, neck pain, back pain, shoulder, knee, that type of stuff. And so we're taking extra precautions than we normally have. If you know me, I don't normally wear a mask. It's the first time ever in clinic that I've worn masks and had to treat patients with gloves and whatnot for the chiropractic side of things. So I want to go over some of the procedures that we're doing here in the clinic. I have Miss Tiffany with me. So after each and every visit, what we're doing is we're spraying down and disinfecting the tables. So we're taking extra measures of keeping everything clean, cleaning the face area, cleaning off the table, making sure that we are keeping everything as clean as possible with everything COVID-19 that is going on. Between every interaction, you'll see that all the staff members, we have our gloves on. We are changing them in and out between patient interaction. We're cleaning the surface of the tables in the room. So we're taking all these extra measures because we know that there are a number of people that are still in pain. Pain doesn't care when when we have a COVID-19 epidemic. We actually have a number of the area medical offices, primary care offices, urgent care centers. We've even gotten in contact with some ERs about sending their patients over to us so that we don't back up the ERs and the urgent cares and the primary care offices so they can focus on what they need to do. So I want to take you around the office. I'm going to show you a couple other things that we are doing as well. So follow me on here. We finished up. We wrapped up with patients at the timing of this video. So if you come on up to the front, we again are cleaning everything, cleaning the front rooms. We got Tammy up here at the front. Tammy has even gone as far as we're Lysoling every single pin that is up here, all the surface areas. You can see if you come over here, our waiting room is a little bit more blank. Even our magazine rack, we don't have any magazines in there because we don't want any transmission through that. And I'm going to go into the rehab room, so follow me over here. This is Hannah's area. Hannah's behind the camera. She's coming over here. So Hannah is taking care of the patients back here. After every time that somebody has to get on one of the tables, do any therapy, whether we're talking about the decompression therapies, you'll notice that if you're a patient of ours, the tables are spaced out a lot more, just so we're keeping everything 6 foot apart with the social distancing. We're limiting to some of the treatment in here, just for the bare necessities that have to be done here, that you can't do on your own at home, but we're giving a lot of home instructions as well. But if you're suffering with neck pain or back pain, I just want to let you know that, that you can come in and give us a call. Go ahead and follow me this way. We'll come out just a couple more things. Obviously the bathroom, that's getting sanitized, that's getting disinfected, coffee area, all those things. So anyway, if you need help, if you're in pain, you want to avoid the ERs, avoid the urgent care centers and the primary care, your primary care doctor, you can call our office. Our information will be here at the end of the video. We'll be happy to take care of you, get you in, get you taken care of, get you out of pain, so you can live your life more comfortably while we're on the quarantines and whatnot that we're experiencing. So anyway, give our office a call if you need some help. We'd be happy to serve you. Have a wonderful day.